What are alternatives to benzodiazepines for akathisia? Have you ever felt an overwhelming urge to move, like you just can't sit still? This feeling is known as akathisia, a movement disorder often seen in people with schizophrenia. It can be particularly distressing, especially for those taking antipsychotic medications. While benzodiazepines have been a common choice to help manage this condition, there are several alternatives worth considering. Let's take a closer look at these options. One effective alternative is beta blockers. Propranolol is a well-known beta blocker that can help reduce the physical symptoms of akathisia. It works by blocking beta-adrenergic receptors, which can decrease feelings of restlessness and agitation. Many doctors consider propranolol a first-line treatment for akathisia due to its effectiveness. Another option is anticholinergic medications. Benztropine is a popular choice in this category. These drugs work by blocking acetylcholine receptors, which helps restore balance among neurotransmitters that may be disrupted by antipsychotic medications. However, it is essential to note that anticholinergic medications can cause side effects like dry mouth, constipation, and cognitive impairment. Serotonin 5-HT2A receptor antagonists also show promise in managing akathisia. For instance, low-dose mirtazapine blocks these receptors and has been reported to help reduce akathisia symptoms. Some antipsychotics, like brexpiprazole, have a higher affinity for serotonin receptors and tend to have a lower incidence of akathisia compared to others. Vitamin B6 is another potential adjunctive treatment for akathisia. Some studies suggest it may help improve symptoms, although the evidence is not as strong as for beta blockers or serotonin antagonists. When treating akathisia in schizophrenia, it is vital to balance symptom control with overall management of psychosis. Adjusting the antipsychotic regimen can also be part of the strategy. Switching to medications with a lower risk of akathisia or using partial dopamine agonists can help. Combining these pharmacological treatments with careful monitoring and supportive care can lead to better outcomes. So, if you or someone you know is struggling with akathisia, consider discussing these alternatives with a healthcare provider. They can help determine the best approach tailored to individual needs.